So today we are looking at how to deal with asthmatic symptoms, and we know that the world's population, about 5 to 10%, battle with this kind of condition. And the reason why we are looking at this is because this video is not only for people having asthma. There are other situations that people get, and sometimes it seems they have asthma, but it is not asthma. Hay fever can be one of them, stress can be one of them, apnea can be one of them, and not being able to sleep can also, you have similar signs and symptoms of what I'm talking about. So in the video, we are going to learn certain things that would actually help us it's a form of practice and also an education that will inform us about our health, so that we can actually, get rid of these symptoms, be it an asthmatic symptoms, be it a panic attack, be it an apnea, a hay fever, a stress, and not being able to sleep. So the video is actually for people from all walks of life, not necessarily for people with asthma, because some of these people do not actually have asthma. They don't have any history of asthma, but you realize that some of the things that I'll be talking about in this video, they are things that they have been experiencing, they have been going through. So we will get to know it very soon, even as we go down in this education. All right, so for a moment, I'd like to show you a data that is going to guide us in our studies. And over here, we see this is the normal data, and over here is the asthmatic data. I want us to check the difference. So we're going to be, the first one is the breath per minute, and the second one is each breath, what it contains. The third one is volume per minute. So we realize that the normal person and the asthmatic person, they are not the same. So basically, asthmatic people consume more air than the normal person. And that's the fundamental that we have to know about this. Back the days in school, we were taught that human beings need more of oxygen than carbon dioxide, and our plant needs the carbon dioxide, but actually that's not true. CO2 is equally needed just as carbon dioxide in our process of breathing. Yeah, it's very important. You don't have to say that oxygen is more important than carbon dioxide. There's actually a process that I'm going to take us through very soon. It's called the Bohr effect. And then the Bohr effect, it talks about the CO2 and the oxygen. So for us to be able to get enough oxygen in our blood, we need an equal amount of carbon dioxide that the body requires of us, so that we can actually breathe properly. CO2 is normally considered as a waste gas, but it is equally important as oxygen, and even more important in people dealing with asthma. And we will know why even as we talk about the Bohr effect or the Bohr effect. And I believe this will actually buttress our studies and also give us a clarity of what we want to arrive at. The Bohr effect says that the binding of oxygen in your blood is dependent on carbon dioxide. So in other words, we can conclude that oxygen cannot be carried out in your blood unless you have enough carbon dioxide. And so carbon dioxide, that it is ascribed as a waste product, is actually not true. Yeah, they are both very important in our breathing process. All right, so we want to take this exercise. It's very important to hold your breath, and I'm going to share with you, the range that you are able to hold your breath and what it means. So the first one that I like us to look at is when you are not able to hold your breath for more than 10 seconds. It's a clear indication that you are having a severe situation. That could be asthma, maybe a panic attack, maybe hay fever, apnea. Like I said earlier, it's a very severe situation that you've got for you not to be able to comfortably hold your breath for 10 seconds. And so you would have to follow me even as I take you through what you can do when it happens. Like now, let's go to the next range or the next category of holding of breath comfortably. If you are able to hold your breath for 11 to 20 seconds, you may have symptoms related to asthma. You may, but for the 10 seconds, less than 10 seconds, you actually have severe situation that you need to look at it. Yeah, so this one, you may have symptoms related to asthma, and so you would have to check something that I will also share about, in this video. Now, the next one is when you are able to hold your breath for 21 to 40 seconds. It means that you are going to have less symptoms of asthma. Now, above 40 seconds, it tells that you really don't have any problem with asthma, and you don't have any stress situation and apnea, hay fever, whatever. So, like the conditions I talked about. So, people who are able to hold their breaths above 40 seconds, it's a good therapy. And I normally do this under the shower, and I'm able to hit like 1 minute. Yeah. So initially when I started to do it, it wasn't so comfortable, but I practiced and then it became normal to me that I can hold my breath for like 1 minute and very comfortably. So you can actually start this exercise, and sometimes it will become so tiring and very tedious, but you keep breathing in and out. These symptoms of asthma that I talked about, that could also be other conditions like apnea, high fever, and stress, and not being able to sleep. Your ability to hold your breath comfortably for the required range I talked about can actually predict your situation. Finally, this technique is actually going to help to increase carbon dioxide and nitric oxide in your blood, and that is really going to help you in your breathing process. And because nitric oxide and carbon dioxide, we need a lot of them in your blood to ensure an easy way of breathing, and also having a clear air pathway. So holding your breath is an indicator to show that you are progressing or not. So like I said, you can't be trying. I remember the first time I tried, I went to like 40 seconds, yeah, and I kept doing it. So now I go beyond 1 minute, yeah, comfortably. So you do it, and it's really going to increase the production of nitric oxide and carbon dioxide. That's going to help you in the breathing process. Now let's come back to the Bohr effect. Breathing a volume of air that is greater than the normal air, just like we see people, gasping for breath, like they try to, do it faster, so that it doesn't really help. And this is because of the Bohr effect that we are talking about. So the more air, the less oxygen is delivered, because the blood is already saturated at 90 to 98%. This will finally make the oxygen to bind up with the blood, and that is why a lot of people ventilate and even pass out when this happens. So the less carbon dioxide you have, the more airway becomes constricted. And this is what we might not know, but CO2, that is the carbon dioxide that is known as the waste gas, it actually relaxes the smooth muscles in your lungs. And this is something that we have already talked about, so very important in our process of breathing. So then, the real problem of asthma and other conditions related to asthma, like the apnea, like stress, like hay fever, is one's ability to force yourself to, breathe heavily. Here is a very important point, even as we have talked about this Bohr effect and all this and all that. We want to talk about another technique that you can do when there's an asthmatic attack, be it an apnea or be it any kind of situation that is related to asthma. It might not be an asthma, like I said earlier. You can actually start practicing this technique anytime you experience that. It could be a panic attack, it could be an asthma, it could be an apnea, it could be stress, it could be sleeping disorder, it could be hay fever. So this technique is for you. The first one is you have to stop breathing fast through your mouth and start to breathe slowly through your nose. So you stop breathing very fast breath through your mouth, and then you start breathing slowly through your nose. That's the first thing. So instead of sighing and also gasping for breath through your mouth, take it slowly, in a gentle way, very softly through your nose. And this is another technique that you can also do. It will be very difficult, but as you do it, you realize that it's picking up, and then you are getting your normal process of breathing. So in conclusion about these techniques, we realize that we are stopping to breathe through the mouth and breathe through the nose. So that is basically what we are trying to talk about this technique. Yeah, you have to also conscientize yourself. Try as much as possible not to breathe with your upper chest or your diaphragm, but rather you have to breathe with your stomach, and that is really not going to put so much stress on the diaphragm, and that's a good way to come back to normal. So these techniques are things that anybody can do to correct the situation that the person may find his or herself in. Thanks so much for making the time to watch me on this channel, and I hope that this video really helps you. And if you like this content, kindly subscribe to this channel. You can also like this video and share. See you same time next week. Bye bye.